So coming on to the P waves, the P wave occurs due to atrial depolarization. Now, the normal duration of P wave is less than 0.12 seconds, that is 2.5 to 3 small squares. Now, do you understand why 2.5 to 3 small squares? Because one small square is equal to 0.04 seconds. Therefore, 3 small squares is equal to 0.12 seconds. So the normal duration of P wave is 2.5 to 3 small squares. Now, if the P wave is more than 3 small squares, then it will be found in left atrial enlargement, and it will slightly bigger or M pattern. And if the P wave is less than 2.5 small squares, then it occurs due to right atrial enlargement, and it is slightly peak or taller than the normal P wave. Okay. Now the PR segment. Now in the segment, there is no current flow. All these are isoelectric points or straight lines. Now this is the PR segment. This PR segment occurs after the P wave and before the onset of QRS complex. So this PR segment occurs after P wave and before QRS complex, means after the atrial depolarization and before ventricular depolarization. Now this PR segment denotes, wait, okay, okay. So it normally denotes AV nodal delay. Now this is a physiological delay and why it is physiological delay? Because this delays the impulse to pass from the SA node to the bundle of His. From atria to ventricles, it delays the impulses to pass. And this is a physiological delay so that the whole of the blood from the atria will eject out and goes into the ventricles. Okay, and this physiological delay is of around 0.10 seconds. Okay. Now the PR interval. Now PR interval. Now what is the difference between segments and interval? Now in segments means only the straight lines where there is no current flow, but in the intervals we include waves plus segments is equal to intervals. So in this is a PR interval. So PR interval starts P wave plus PR segment is equal to PR interval. So atrial contraction plus physiological delay is equal to PR interval. The duration of PR interval is 0.12 to 0.20 seconds. If it is more than 0.20 seconds, it means there is a conduction heart block. Okay. Now Q wave. Wait. Now Q wave. Q wave occurs due to ventricular septal depolarization. It is considered pathological if it is more than 2 mm deep and more than 1 mm wide. It is typically seen in V1 to V3 chest leads, and it is considered pathological in current MI or prior MI. Okay. So coming on to the QRS complex, this QRS complex occurs due to ventricular depolarization. Now, the duration of QRS complex is 0.08 to 0.10 seconds, that is 2 to 2.5 seconds. Okay. Now, if the QRS complex is narrow, or the QRS complex could be wide. Now, QRS complex is narrow in supraventricular tachycardia. Examples are atrial fibrillation and atrial flutter. Whereas the wide QRS complex occurs in ventricular tachycardia and torsids de pointis. Okay. Now ST segment. ST segment. Now similarly like the PR segment, in ST segment there is also no current flow, and these are also isoelectric points and straight lines. So this is the P wave, this is Q wave, this is R, this is S, and this is T wave. This is P, Q, R, S, and T wave. So this ST segment forms after the onset of QRS complex and before T wave. Okay. So ST segment form end of QRS complex and before T wave. End of QRS complex means after ventricular depolarization, and before T wave means before ventricular repolarization. Okay, so in the ST segment there is no current flow. So it is basically a straight line like this. But if there is a current flow, then the ST segment could be elevated or depressed. Now, causes of current flow is, it may be pathological, means injury occurs to cardiac muscles. Okay. So now ST segment elevation or ST segment depression. ST segment elevation and ST segment depression. Now, the causes of ST segment elevation is MI, pericarditis, or increased potassium level, that is hyperkalemia. Whereas the cause of ST segment depression is basically seen in chronic stable angina, or it is seen in hypokalemia. Okay. Now, how will you understand that after seeing this ST segment elevation or depression, that it is an inferior wall MI or the anterior wall MI or lateral wall MI or the septal MI? So, if these ST elevation changes occurs in lead 2, 3 and AVF, then it is an inferior wall MI. If these changes occurs in AVR, V1, V2, then it is a septal wall MI. If these changes occurs in V3 to V4, then it is a anterior wall MI. And if these changes occurs in AVL, lead 1, V5 and V6, then it is a lateral wall MI. Okay. Now coming on to QT interval, as we already discussed that the segments carry only the straight lines and the intervals carry the waves plus the segments. So this QT interval will carry the QRS complex plus the ST segment plus T wave. Means before QRS complex and ends with end of T waves. Means this QRS complex shows the whole ventricular depolarization and ends after ventricular repolarization. Now the normal QT interval time period is 0.36 to 0.40 seconds or 9 to 11 small squares. Okay. See, this is the P wave, this is the Q wave, this is R, this is S, and this is T wave. This is P, Q, R, S, and T wave. I am changing the color so that you will understand this. Okay. So the QT interval starts from here, this line, and ends after the T wave. And the normal duration of this QT interval is 0.40 seconds. Okay. Now coming on to tall T waves. T waves occurs due to ventricular repolarization. Okay, the height of the T wave is less than 5 mm in limb leads and less than 10 mm in chest leads. Now, what are the hyperacute T wave? Means if suppose this is the QRS, this is R, this is T wave. Now this is the hyperacute T wave, in which the T wave is normally larger than the normal T wave. It is seen in conditions like MI. Now the tall tented T waves, means, see, this is the Q, R, this is R, and this is T. And then the T wave is larger than the R wave, and this is seen in basically hyperkalemia. Okay. Now coming up to BAZETTS formula, many of the students ask, sir, that how to calculate the corrected QT interval, and we don't know how to calculate this. So this is the BAZETTS formula for calculating the corrected QT interval, and in this, see, the formula is corrected QT C is equal to QT upon under square root of RR intervals. That is, now how will you calculate that what is the time interval of QT and what is the time interval of RR? So this is the RR interval and this is the QT interval. Now you calculate the small boxes in between the QT interval, that is, this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 and 13. So 13 small squares means 1 small square is equal to 0.04 seconds. So the duration is 0.52 seconds. Okay. And similarly the RR interval means that there is 24.5 small squares and 1 small square is equal to 0.04. So it is 0.98 seconds. So 0.52 upon under square root of 0.98 means 0.52 upon 0.989, that is comes around 0.525 or 0.53 seconds. This is how we calculate the corrected QT interval time.